Hello, everyone. My name is Doreen Tembo, and I head the Patient and Public Involvement team at the National Institute for Health Research, or the NIHR. And within the NIHR, I work in the Evaluation, Trials, and Studies Coordinating Center, and also lead our global health research community engagement and involvement work, working in very close collaboration with other parts of the NIHR, as well as the UK Department of Health and Social Care. So what I would like to do today is to provide a brief summary of our global health programs and how we work with patients, with carers, with the public, and with communities within this program, and also try to frame the debate that we will be having today around the perspectives from the global north and south as the NIHR works in both these spheres. We are a relatively new global health funder. We started working in global health around 2016, 2017. If I can have the next slide, please. So the NIHR is a major funder of high quality research that primarily and directly addresses the diverse health needs of people in low and middle income countries, also known as LMICs, working in collaboration with other global health leaders. We fund research with direct and primary relevance to improving the health of those in LMICs, as listed in our global health portfolio. And this is funded by the Official Development Assistance, ODA, which emanates from the UK aid from the UK government. So we fund research in ODA eligible LMIC countries, and these need to be listed in the OECD, or Organization for Economic Cooperation and Development, and within that, the Development Assistance Committee list. So we ensure that there's no disadvantage relating to areas such as diversity, gender, and disability, according to the International Development Act that was enacted in 2014. We work in three main spheres. We fund programs. We also fund partnerships and people, especially looking at capacity building and strengthening training within both the UK and LMIC institutions as well. Could I have the next slide, please? On the partnership side, this very busy slide shows how active the Department of Health and Social Care have been in collaborating with a wide range of partnerships through which we fund a diverse range of research and initiatives which target key global health challenges. We work with major national as well as international funders, as well as with alliances that address specific condition areas. The partnership strand accounts for around half of our global health research funding. Could I have the next slide, please? The other half of the funding is made up of a number of global health research programs. The largest of these are the units and groups, which are calls which fund UK universities and research institutions to submit applications either to expand or develop their ambitions to deliver world-class applied health research, working in equitable partnerships with researchers in low and middle income countries to address underfunded or under-researched global health areas specific to those countries. And then we have the NIHR Research and Innovation for Global Health Transformation, or RIGHT program, which funds cutting-edge interdisciplinary applied health research in key areas in ODA eligible countries where strategic and targeted investment can result in a transformative impact. Through the Global Health Research Professorships, we are strengthening and building capacity in global health research, providing opportunities and funding initiatives to develop and advance global health research career pathways, both in LMICs and the UK as well, through funding research leaders to promote effective translation of research and to strengthen leadership at the highest academic levels. And finally, we have the one of the newest programs, the NIHR Global Health Policy and Systems Research, Global HPSR programs. And this aims to support research in global health policy and systems research, which is directly and primarily of benefit to people in low and middle income countries. We also have a number of ad hoc calls, including, for example, recently we funded COVID research in global health, And we also have a forthcoming call that will be awarding funding directly to institutions in low and middle income countries. So if you'd like to find out more about these funding opportunities and the role that community engagement and involvement plays in them, then please feel free to visit our website. If I can have the next slide, please. So that's the link to our website, and then we can move on to the next slide. So that's the program. So how does community engagement and involvement fit within that program? Well, in the UK, the movement to engage and involve those affected by research hails from similar attempts ranging back to the 1960s and 70s to ensure that patients were involved in making or expressing opinions about their treatment. This is in healthcare. This was then subsequently embedded into healthcare management and then in research from around 1993 and 1996. This was spearheaded by an organization that some of you may know called Involve, which was then made part of the NIHR since its inception in 2006. Within the context of global health and research, community participation or engagement, this has been a feature in global health research decades before the landmark WHO and UNICEF-sponsored declaration of the Alma Ata in 1978, and is now a cross-cutting feature of the UN Sustainable Development Goals, which the NIHR are also committed to. So while the NIHR strictly adheres to terminologies and meanings around the words participation, engagement, and involvement, if we look at this within an international context, there's less differentiation between these terms. But the NIHR recognizes the importance of engaging those who are affected by research, which includes promoting health and research literacy to ensure that communities can work with the research community and with funders. But we also promote active involvement or partnership with community members so that the research isn't being carried out on them or to them, but actually with them, and that they're involved in decision making in the project or the programs that we fund. We call this approach community engagement, recognizing that you need to engage people in the process, and involvement, recognizing that very active partnership working or co-productive approach. Next slide, please. As such, we have community engagement and involvement in all parts of the research we fund, right from the start when research priorities and research ideas are being identified and prioritized through the design, oversight of the project, where appropriate, actually being involved in data collection and analysis, dissemination, monitoring, and evaluation. A unique contribution that the NIHR has is the involvement of patients, public carers, community members in our actual research management processes. And they do this by reviewing applications. They're also equal members of funding committees. And we actively monitor and evaluate and disseminate community involvement and engagement outputs throughout the life cycle of the research we fund. We offer support to researchers that we fund by providing detailed guidance, and we also have awards for teams to build partnerships with the community, especially in the developmental phases of the projects. We also have a guide around community engagement and involvement, and are developing further resources as well to support community engagement and involvement. If I could have the next slide, please. So part of our support, we work with the MESH network, and this is part of the Global Health network, and they further knowledge sharing, and it's basically a hub for people working within community engagement to access resources, to make connections, and really to work together to further community engagement and involvement within global health. And if you'd like to find out more about MESH, we have the coordinator of MESH as well as part of this seminar. If I could go on to the next slide. So finally, I wanted to touch on our, excuse me, underlying values, principles, and standards. Underlying everything is understanding that the notion of community in global health is wider ranging than our understanding of community here in the global, South is wider ranging than our understanding here in the global North We tend to focus very much on lay involvement, on public members and patients. But within the Global South setting, you include a wider range of everyone that is going to be affected by the particular research that is being carried out. So for the Global Health Program, we especially have co-production underlying our values, principles, and standards. We understand that research teams need to share power where the research is jointly owned and people work together to achieve a joint understanding or objective. And this involves building and maintaining relationships amongst all those involved. We also recognize that we need to respect and value different knowledge, ensuring that we include all the perspective and skills that are needed to successfully deliver the research, including community members who have on-the-ground experience and are affected by much of what we research. Finally, the research should ensure that the benefits from the research are reciprocal or mutually beneficial for the whole team, recognizing that people will have different values, and we need to consider outputs from the research that are not only what is valued, say, by the academic community. In conjunction with co-production and the principles there, we firmly believe in the minimum standards and indicators that have been produced through a collaboration between UNICEF and various national and international organizations. These center on what is called participation, although within the UK context, we would call this involvement. It also centers on empowerment of all partners working to produce research. Inclusion, ensuring that the most vulnerable people that are affected by the research are not left behind. Bi-directional communication, making sure that we're not just disseminating out, but that we welcome and encourage feedback. Adaptability and localizing the research to ensure that we're not exporting things that work within the global north context to the global south without exploring whether they will work in different contexts and vice versa. And finally, that we build on local capacity, harnessing and strengthening the structures and capabilities already actually present in communities in the global south.